The trial that really resonated with me at ASCO is probably as far as you can get from TAILOR-RX, that had the highest number of early stage patients at 10,000, but the Talazoparib trial that had 20 patients. But I think what was so pivotal is that that was really the first trial of a targeted therapy in BRCA mutant patients that was given neoadjuvant in these patients with an early stage breast cancer, and showed that 53% of the patients with just a pill, a PARP inhibitor, 1 milligram, unless they had dose reductions, could expect to achieve a complete pathologic response in the absence of chemotherapy. And if you included the residual cancer burden patients, that was 63%. So I think that's really exciting to see that, you know, another step away from chemotherapy or de-escalation, but replacing it with a very targeted therapy for a very targeted defect. And so I think that's real exciting. I think we'll learn how to manage the heme toxicity, which was, I think, the other resonating signal, that there's a fair amount of anemia. There are 29 transfusions among those patients. And so that's something we're not quite used to. But, you know, as I always tell patients when I talk about therapies and they're like, oh, great, we're not going to get chemotherapy. And I'm like, other drugs have side effects too. So I think the classic in the patient's minds are always chemotherapy. But, you know, when we look at the immunotherapy, we look at our mTOR inhibitors, you know, PI3 kinase, we're learning about a different line of toxicities. And I think that was the same with the PARP trial.